Assalamualaikum. My name is Aska Farooq and my roll number is BP1650051 and the topic of my presentation is Bacitracin. Now let's talk about Bacitracin. It belongs to the class of peptide antibiotic which is active against many gram-positive organisms. It is also available as an ointment which can be applied topically to treat minor skin injuries including cuts, scrapes and burns. Bacitracin was approved by FDA in 1948 for short-term prevention and treatment of both acute and chronic localized skin infection. Is also available as a parenteral medication for systemic treatment of infantile streptococcal pneumonia, but it is used less frequently. Rational and irrational use. Rational use. Most commonly, bacitracin is used for the prevention of skin infection after burns or minor scrapes. It is also found frequently in combination with neomycin or polymyxin. It is also used to treat infection caused by staph aureus and is effective when applied on a small area of the skin. Prescribing bacitracin in the absence of bacterial infection or prophylactic indication can increase the risk of development of drug-resistant bacteria. Secondary infection, especially fungal infection, may occur with the prolonged use of bacitracin products, and patients who are sensitive to neomycin may also be sensitive to bacitracin. Numerous reports have found an association between allergic contact dermatitis and bacitracin, with the number continuously increasing. Adverse effect. The most common serious adverse effect of bacitracin is nephrotoxicity, which can happen with any form of administration but is most often associated with systemic therapy. Urticaria, fever, hematologic toxicity, eosinophilia, pruritus, skin rashes, including anaphylactic shock, have been reported rarely during systemic bacitracin therapy. Nausea, vomiting, itching, sweating, injection site reaction, skin rashes are some of the commonly observed side effects. Bacitracin-induced nephrotoxicity is mostly associated with IM administration of bacitracin and is related to dose and duration of therapy. Renal failure may occur due to glomerular and tubular necrosis. Contraindication. Bacitracin is contraindicated in patients who are sensitive to any bacitracin-related product. Topical application of bacitracin is not indicated to be used over large areas of the body. OTC use is recommended for minor abrasion, burns, and wounds only. Topical bacitracin is contraindicated for serious burn, deep wounds, puncture wounds, or animal bite without consulting a physician. Toxicity. Toxicity is not commonly observed when bacitracin is used as single-agent ointment or part of triple therapy ointment. However, the IM route has been shown to cause nephrotoxicity and renal failure due to tubular and glomerular necrosis. Accordingly, there should be careful monitoring with the IM use of bacitracin. Renal function should be under observation before, during, and after the IM administration. Here are some drugs which can interact with bacitracin, which include acetylphenic. High serum level of acetylphenic may be due to decreased excretion rate caused by bacitracin. Acetaminophen. Bacitracin may decrease the excretion rate of acetaminophen, which could result in a higher serum level. Acetylsalicylic acid. The probability of intensity of nephrotoxicity can be increased when bacitracin is used with acetylsalicylic acid. Ceftriaxone. Higher serum level of ceftriaxone may be due to decreased excretion rate caused by bacitracin. Acetylfumarole. The likelihood or severity of bleeding can be elevated when bacitracin is used in combination with acetylfumarole. General anesthetic. Bacitracin may act synergistically to expand skeletal muscle relaxation produced by neuromuscular blocking agent and or general anesthetic. Adult dose of bacitracin include 12,000 to 12,500 IU per gram 8 hourly topical, and pediatric dose include 12,000 to 12,500 IU per gram 8 hourly topical. There are many brands available in the market of bacitracin, some of them which include Multifax ointment 20 gram is available in 30 rupees, Bacimix ointment 10 gram is available in 55 rupees and 15 gram is available in 69 rupees. Polyfax ointment, which is most commonly used, is available in 20 gram and 20 gram is available in 72.57 rupees. There are many alternate choices of drugs which are available in the market. Neosporin can be used instead of bacitracin, and they both belong to the class of topical antibiotics, and they are medicated creams that can be used directly on the skin for minor infection. Bacitracin ointment only contains one antibiotic, and Neosporin offers broader antibiotic coverage that may fight many types of bacteria. Petroleum jelly products such as Vaseline can be good alternative to bacitracin, and the jelly keeps the wounds from drying out, which can prevent or ease itching and other unpleasant symptoms. Now let's discuss a case study related to bacitracin in which there is a 29-year-old woman who goes to a pharmacy with a burn on her left leg from spilling a pot of very hot soup. The burn covers her half left leg and appears white when pressure is applied and red when released, and there is a pain on touching, and the first layer of skin seems to be burned somewhat. Her weight is 60 kg, BMI 23.4, and has normal BP. What would be the treatment procedure for her? The subjective include age 29, gender female, weight 60 kg, chief complaint burn left leg. Objective include BMI 23.4, BP 120 per 80, pulse normal. Assessment. Assessment include the burn can be classified as a first degree burn because it involves the first layer of skin and is painful to touch, red, and becomes white with pressure. Scarring is unlikely with this type of burn. The first degree burns are not so severe and can easily be treated by topical antibiotics. Plan include her wound should be cleaned with cold water and leave it until the pain diminishes, and then apply appropriate amount of topical antibiotic bacitracin 500 units per gram Q8 hourly, then cover it with wound dressing to prevent any infection. She can also take prescribed dose of OTC analgesic ibuprofen 200 mg Q6 only to help her with the pain. Thank you.